Okay, this is going to be the RAO sternum, so the patient is going to put their chest up against the board. Now for the sternum, it's going to be a 15 to 20 degree obliquity. We are going to go 20 degrees if the patient is normal shaped, but if the patient is barrel chested, then we are going to go 15. So I just remember the wider people need less degree of obliquity, the average person needs more degree of obliquity. We want to go midway between the jugular notch and the xiphoid tip, which ends up to be around T5, or the sternal angle. So we're going to rotate our patient about 15 degrees. Take a step forward. Okay. And then we're going to go midway between. So I want to make sure that I have light above the jugular notch, but I also have light below the xiphoid tip. Right now the bottom of my light is hitting at the level of T7. So what I'm going to do is open up my light field, and then I'm just going to readjust the height here so that I'm midway between. And you see how I have light above the jugular notch and below, about 2 inches below the T7 or inferior angle of the scapula. I will then line up my Walbucky, 15 degree. We've got the shield back behind her this time to help shield the gonadal area. Now with this one, we're going to do a breathing or orthostatic technique, which means the patient's going to be quietly breathing during the exposure. We want a minimum of 2 seconds, ideally 3 to 4 seconds as we're making that exposure. And that helps to blur out the ribs. We do the RAO instead of the LAO because this is going to put the heart shadow as a backdrop behind the sternum so that you can have an equal density to be able to see the jugular notch, the manubrium, the body of the sternum, and the xiphoid tip.